All right, welcome back to the Dr. Vincent Buscemi podcast. We're in a brand new studio in Brighton, Michigan, the Speakeasy. Normally, I'm in my basement at 4 in the morning on a Sunday with a musty basement, a bad camera, but today we're not. I have two exciting guests. We have Craig and Nate with Simio Physical Therapy, and I want to start real quick with who this podcast is for. If you're a 40-year-old woman, aches and pains, you're always tired, but you're doing everything right, I think we have a solution for you. And I think we have the two guys here that can help us kind of understand what's going on. So Craig, give me some of your background on how you got incorporated working with dentists with protecting the airway and protecting posture.
Yeah, well, it is kind of a long journey because I don't think we can ever start where we end. And so for me, I started very early on in my career as a PT studying something we call patterned human asymmetry. And back then, when we were doing kind of orthopedic stuff, looking at hip position, leg length differences, arch, pains in the back, all of that, there was a lot of consistencies to things that we find. We tend to always see that maybe uh, 80% of people would come in with right low back pain versus their left, or it was always an upper trap causing headache on the right side of the neck. And all of this stuff started to show up as a pattern. And so as I started to look more into that and try to find effective ways to treat, it was always one thing that led to the other. So pelvic stuff was informed by low back and rib and diaphragm stuff. So I couldn't be really adequate at treating somebody's hips and their lower limbs until I started studying more about things like respiration and how we fill our chest and what direction we move into when there's deviations in posture, like we might have lower shoulders because we stand on our right foot more often or our left foot more often. So all of us have these tendencies in us, but to be really effective at correcting like leg length difference and pelvic positional things that most of us know we have. We go to the chiropractor, we go to a therapist, and they look at our leg length and say, "Hey, things are always off." They put them back in, but it doesn't stay that way. So as I started to get frustrated by that revolving door, it made sense to me to start studying respiration. So I started to get more details there where we don't get a lot of that in our traditional PT health education. And as I moved my way up to studying respiration, you can't study breathing unless you study airflow and the airway. And of course, that's your wheelhouse in that you command as a dentist that gateway. All air, all water, all nourishment comes from through the hole that you control as a dentist. But my education, as I started learning about the airway, started meaning that I needed dentists to help me solve orthopedic problems for patients' pain. And so I started to network with many dentists and started to study things that relate to like cranial position, cranial strain, cranial torsion. These are things that cause, in dentistry, you would call it bite distortion. And so sometimes we think about wanting the teeth to be straight and the jaw to work just right. But what if something about the way we position our head affects the pendulous motion of the jawbone? So now it's not just how the jaw goes up and down, it's actually about how we position our head over top of our chest over top of our pelvis over top of our feet. And of course, our feet have to relate to the shape of the ground underneath us.
So tell me more, and Nate, jump in at any time, about these patterns. So people get stuck in some form of physical pattern. And then how do we get out of these patterns?
It's kind of like what mama used to say, if you make a face long enough, it sticks that way, right? And it kind of is that way for us. We strengthen patterns of adaptation. And that's an important word because none of us are perfect and none of us are symmetrical. And I don't think that symmetry should ever actually be the whole goal. It's too hard to obtain. What matters is the ability to function in and out of moving left and moving right, crossing a midline, not having perfection at that midline. And so when we look at things that you get strong at doing, um, some people are repetitive rotation athletes like golf and tennis and pickleball, things like that. Some people are, say, right-handed dentists who will always have the patient to their left, but turn to the left with their body. So instead of being a right-hander that orients to the right to do things, you have to engage your career moving left and finding ways at getting good at being left. It just so happens that there are some influences in our body that make us a little stronger at going to the right. A lot of us start that way, but as things happen over time, we adapt and change. Part of that it has to do with the way that our chest accepts air. So air follows the path of least resistance. So if we have an orientation to the right, it will make the front of our right chest present as the bigger side, and air will flow into that side. In that position, we have a respiratory diaphragm that rises and falls that might be optimized to pull more air into one side than the other. And if we get into a bias that way, we'll keep doing that. And in the process of doing that, let's just say that we stand on our right foot more, the muscles of our right leg are going to start developing into a strength pattern there. And that means that every time we do something that requires more strength, we might call on that limb. And so we can see oftentimes when we look in the mirror that we'll have one shoulder low and we have more weight centering heavier into one foot. And I ask my patients that in the treatment room just so I understand and kind of inform myself as to what their body's preference is for strength and posture and position. The tricky part comes when somebody gets stuck there because if they go to the other side, let's just say I'm patterned on the right, and then I go to try to stand on my left leg. If I stay in some right patterning while I'm on my left side, that can present itself as like an overuse circumstance where muscles, they never get a break, they never let go. And that creates chronic tension and can result in chronic pain and other overuse injuries that sometimes leads us to orthopedic surgeries like wear and tear on joints and arthritic changes.
I think that's the biggest thing. And then Nate, I want you to chime in here too. I'm almost 40 and I definitely don't move like I did when I was 20. When your patients come in, what are some of the most common complaints they tell you that they're having?
Probably the most common thing is just tension.
Tension.
People relate to tension and they become aware of the fact that there are certain areas that they just carry more tension. I carry stress in my shoulders. So those kind of things people are pretty quick to identify. Or other areas that they feel like, this is just my problematic side. These things seem to be happening always on the right side. So, but I'd say tension is probably the most common thing that people are become aware of.
So these people come in with tension and then you analyze them and you think to yourself, you're doing this form of activity, chronic activity, we'll say, that's creating a pattern. And then how do you help them break that pattern so they feel less tension throughout the day?
I'll try to draw some connections to their tension, and then when we do an exercise, kind of relate it back once we retest and we see things have changed, kind of draw that back to their area of tension. So sometimes it's the low back.
Okay.
A lot of times it's the low back. And so there'll be some tests that we do that look at pelvic position and do an exercise that is trying to restore some good diaphragmatic respiratory posture, and then reassess that and then kind of let them know that there's certain muscles that will be engaged holding you in this position. And now we've done this exercise that is tried to inhibit these muscles. And now we see a change very quickly. And that kind of, people like to see that because it's quick and it's obvious sometimes. And that can be helpful for more education about how the nervous system is involved in these things. And
Nate hit on an important couple of words. He used the word inhibit and he used the word engaged. Right. So there's some misconceptions, I think, in terms of how muscles actually function. And we can look at it in orthopedic lens, which would be like stretch, strengthen, joint mobility, things where we have to just execute our will over the tissue and make it change. But our tissues are actually neurologically influenced, our muscles especially, in that when a muscle is acting tight, it might truly be tight and need a stretch. But if that muscle is over facilitated, that means it's being called on by the brain to do a job or to do a task. That muscle won't receive a stretch. So for our patients that don't necessarily know the differences, these are the muscles that you can stretch but never quite loosen. And most of our patients know where they hold their tension. And they might have had strategies with chiropractors, physical therapists, and personal trainers, even massage therapists, to try to resolve this tension. But if there is a neurologic reason for the body to be using that muscle, it will stay tense until you resolve the reason why the body's asking.
So let me cut you off real because this is so interesting because every dentist has chronic pain, but a lot of my patients do as well. So let's say I have a tight muscle and I keep stretching it, there's a part of my brain telling this muscle, don't release. Why is that?
Well, because your body's using it for another reason that you didn't consider. And so some examples of that. I think one of the easiest examples that I can use relates to the ability to balance. So when you stand up, or even just sitting in your chair, you're sitting in a way holding yourself up so that you don't fall. So the brain has a natural responsibility to make sure that you don't land on your face. And at all times, no matter what foot you're standing on or whether you're standing on both feet, there are muscles that are engaged in the background, making sure that you are as efficiently as you can with the least amount of extra work, that you are actually not falling. Those muscles are working in the background so you don't have to think about it. If you had to think about what muscles you were engaging to make sure that you could take your next step when you're walking or running, you'd go nuts because your brain would be too busy. And so all of that stuff happens in our autonomic nervous system.
What does that mean?
So in the autonomic nervous system, it's the section of our brain that's handling all of the background activities for our safety and our survival, which includes not falling on our face. It also includes making sure that your heart beats enough times. It makes sure that you take enough breaths. And it makes sure that if something stressful was happening, you would be able to run. So most people know like the sympathetic nervous system is that fight flight. I want you to also think like the word engage, like Nate said, or even the word inhale. And if we think about the other branch that most people know about, it's the parasympathetic nervous system. I want you to think about rest, digest, also thinking about the word disengage or exhale. We have to soften for the air to go out, to leave, and we have to tense for the air to come in. So even respiration or breathing would alter our body's body position and then also influence that sense of center that we're holding ourselves up into to make sure that we can efficiently not fall. So imagine if something about your body's breathing or something about your body's sense of center called on extra muscles to make sure that you didn't fall down. So if you're standing and you're in a pattern, we talked about maybe being oriented to the right. A lot of people know, oh yeah, I always stand on my right foot, or I have a history of piriformis syndrome or a history of sciatica in my hips on one side but not the other. People know these things about themselves. And so if you are standing on a right foot, your body should move its center closer to your right. So your head should be like over your right foot, and you should be able to let go of some of the muscles of the left leg so that you can pick that one up and swing it. That's part of walking. And if you have to hold muscles tight to stand up and they don't let go when you start to swing that leg, well, now you don't really move as adequately. And those tensions start to add up across our joints and create pain.
Would you say there's a connect? So a lot of my patients say, I just cannot calm down. I can't unwind. Would you say that there's a connection between mental anxiety and just chronic stress and these patterns people develop?
It's a great question because in the patients that you're talking to, oftentimes you're going to see that a lot because of tension that's happening in and around where air comes in. So we're looking at how well the brain feels safe in its ability to breathe. And that is a manifestation of what the tongue is doing, what the nasal passage is doing, and what the chest in relationship to expansion for air is doing. Your body is measuring that at all times. And so if there's a sense that you're not getting enough, or a sense that you have to do extra work to make sure you get more, those are things that will drive the autonomic system into tension. The sympathetic nervous system starts to get alerted, and you end up sometimes with anxiety, sometimes with upper airway resistance syndrome, which causes lack of rest or even sleep apnea. With lack of rest, you have these nighttime wakeful periods, because what if your brain is always measuring, hey, I need more, and in order to get more, your brain has to wake you up to make sure that you can use additional muscles to pull air into your body. Well, if you fall asleep and those muscles are at rest, you don't get as much air. So it would consistently decrease sleep quality, consistently increase the sense of kind of alarm or even anxiousness. And you'll hear that.
So it sounds like I have some patients that say, even I say this myself, meditation has never worked for me. I just cannot calm down. I'm chronically a wound up person. Nate, do you think if we fix the physical fix some of these patterns,
Hmm.
my mental wound upness will relax. Do you find that in your patients?
Yeah, I would say that in general, yes, that there's going to be a direct connection into someone's just tension, their nervous system. So this, and when it comes to the nervous system, it's affecting everything. So if you can do things that help the brain feel safe because you've improved their ability to manage a good breathing posture that allows them to breathe through their nose better, then you would likely expect that the anxiety, at least as it relates to that sympathetic drive, would start to reduce. But I mean, we're kind of on the discovering that there's a lot more to it than that. I mean, there's what we do in terms of movement patterns, but then your involvement in what's happening up here, and all those things, kind of to really make a meaningful impact. You really have to look at the whole system, and what you guys do is significant for that. So I mean, we play a role in it, and but yeah, for sure.
Do you think our modern society is set up so our brain doesn't sense that we're safe in the way people sit all day or the way they're patterned or they're chronically tensioned, that we feel more unsafe than safe? Because that's a great point you made. You said that if the brain doesn't feel safe, you can't relax. How do we make the brain tell the human you're safe?
I think what we're seeing a lot of is over the course of time, over the course of decades and centuries, that we're being more and more confined in our bodies, especially in our skulls. So many of us need palate expansion. So many of us have tongue functional restrictions, crowded teeth, things like that. And one of the things that I teach is that the body is constantly measuring positional safety through measurements of pressure. Through the nasal passage, it's measuring turbulence. Through the oral cavity and the expansion of the chest, it's measuring pressure to expand. Is it hard to do? Through the sensation of where we are in space, we feel pressure through our feet, through our hips, through our muscle tension. And so, if what's happening in our oral cavity as we breathe or our nasal cavity is that we're getting confinement through lack of normal development, that the brain in the background is having to adapt to that sensation that there's always less. This kind of scarcity mindset kind of overrules a little bit, but we're not necessarily thinking that way as providers who come through traditional dental and healthcare and physical therapy education. We learn that we can just do these techniques and everything will be better. But if the brain in the background is always feeling like there's less than, when we intervene, when Nate and I intervene on neck posture that increases the area for breathing, and all of a sudden the brain can have the sense of I'm getting more, it automatically calms the nervous system, and we can immediately see a change in objective testing. And it's kind of like in your world, you do things like anterior deprogrammers to decrease tension in the neck. Well, imagine if deprogramming happened throughout the entire body. It's a neurologic response. It's not that you stretch their neck and their headaches go away. It's that you put an influence in their mouth, something that interrupts a pattern of consistency that somebody's developed with, and then things start to change. Well, that's the space that we work with, so that we can get people kind of out of the way of themselves and improve their sense of safety because we're offering them more of what their body is measuring as I'm getting less than.
So physical safety does feedback loop to mental safety. And usually you think about physical, you think, I want to have six pack abs, I want to look good on the beach. But you're saying that start with the physical, the body senses it feels safe, and then mentally you feel better.
Yeah, and there's a good example of that where if we look at this autonomic nervous system, we're broken up into three branches. We talked about the sympathetic, we talked about the parasympathetic, but there's also an enteric.
Enteric, what's this?
And the enteric is the gut brain connection, right? But I'm bringing that up as an example to your last question because if you think about the sensations that we have where we have kind of a gut feeling, right? Our sense of awareness of threat, sometimes we can feel as butterflies in our stomach. Those circumstances are real. We just didn't have great words to explain why, but we know a lot more about the enteric nervous system informing our sense of safety through digestion and through the sense of what's called interoception, the ability to sense one's self. Positionally, we have a thing called proprioception. That's also positional sense of oneself. But when we think about the branches between sympathetic, parasympathetic, and enteric, our brain is using all of our sensory systems to determine whether we are in fact safe. And our emotional state, our mental state, oftentimes is very relatable to sympathetic and parasympathetic, that fight, flight, and calm. The words that we use for that were like smell the roses and then blow out the candle,
Hmm.
right?
Mhm.
And so that automatically brings us into the concept of using breath work, or how important respiration and breathing is in controlling the system. We've known forever that if we take deep breaths, we can calm our systems. But now we understand with these patterns and what's happening that causes bias from left to right, when the body feels like it's not getting as much and we can add more, then all of a sudden we can calm that energy as well.
So if I come to you and I just feel like garbage, I go, Nate, I've tried therapy, I've tried this, I'm tense everywhere. How do you first analyze a patient and how do you work them up to start getting them on a better path?
Well, what I would typically do is just look at a postural assessment and just look and see where their body's position is, and then try to relate that to whatever specific discomforts they might have. So, but if they came in and gave me kind of a general, I just feel terrible, I'd probably have to ask a little bit more probing questions in some
Yeah.
different areas. But I try to connect as many dots with people when we're assessing things and treating things to different things regarding their life. So if they come in and, or if I say, hey, if you're having a really stressful day, or a day where you're just go go go, or just thinking about a lot of things, just pay attention to your breathing when you do this exercise, because you might find that it's a lot more uncomfortable to do, or it's harder to pause at the end of the exhale. And so I might just say, hey, just let's do a few minutes of breathing alone, just to calm the system down, and then go from there. And that usually, gets things started in the right direction. But I don't know if I would do anything else than what I typically do if someone just comes in and says, "Hey, Craig might be able to field this question because he's getting more
Well,
people that."
The most common complaints I get are chronic fatigue,
Hmm.
anxiety, depression. And as a dentist, I don't treat any of those. But people in general say I had these three things. And it sounds like we're kind of discovering that there's a huge physical component that's missing that maybe their therapist can't fix.
we have a really great tool that is adapted from a system that's taught by the Applied Integration Academy. And what it does is it breaks up positional tests, regardless of why the position is happening. It could be orthopedic tension that needs to be stretched, or weakness. It also could be obligation to be in a specific position or pattern because of vision, because of dental and airway, because of pattern respiration. But this tool allows us to look from the pelvis all the way down to the arches of the feet. What's the body doing? From the middle of the neck, where our vocal folds, our trachea, our windpipe, wherever the bottleneck for airflow comes in the middle of the neck, all the way down to the pelvis. And then from the top of the head all the way to the middle of the neck. And we look at tests in each of these zones, and we can see how they stack up and relate to each other. What's even more cool about this system is that if we intervene on something related to the neck and the tongue and the teeth, and it changes the objective measurements that we're taking down at the pelvis or at the ankles, we can see cause and effect relationships. So we know exactly where to start to make change that's lasting. And so, in some cases, in the case that we would be working with a dentist, those patients, they're needing dental, airway, and cranial changes so that the pelvis can start to reduce tension. So thinking about people that might have pain, hip pain, back pain, even pelvic floor and incontinence issues, they can be informed by the position that we have to put ourselves in order to be able to center our airway, which is that bottleneck up at top. So this system is something that we take on every patient when we bring them in for restorative services. And what it does is it allows us to get what we call an entry point. We need to know where to begin. We need to pick a side. We need to start to intervene so that we can create a lasting change.
So that's a good point. If you don't intervene at the right place, then treatment is less effective.
Yeah, what we see then is kind of the historic, if I stop my physical therapy exercises, my problem comes back. Or we have this revolving door type of a patient where it just seems like I can help you, I can get you to improve with the exercises or the activities I'm teaching, but I'm not getting you over this hurdle. And then when I discovered that we needed to incorporate autonomics and centering and respiration into care plans, well, now we can get people over these hurdles with strategies that they didn't even think a physical therapist was going to be doing.
So this is where integrative or collaborative care really matters. Because I have patients where I've done some expansive orthodontics and they've gotten tremendously better and their back pain goes away. I definitely don't say, I'm going to fix your back pain because I'll lose my license. But then I have some patients that we do expansive orthodontics and they still have issues. And you're saying, I've maybe started at the wrong entry point. And maybe we should have started somewhere else to start their healing process.
And another way to say that, because you're 100% right, that everything is collaborative. It takes a village. If there's something that that we need a podiatrist for, well, if we don't pull that podiatrist in, well, then we don't get the outcome that we wanted. So figuring out where to start is a really important piece of it. And none of us can do everything. So yes, you probably have had several patients that have had back pain resolve or change because of things that you've done in the mouth, just as much as I can do positional work in the back and the pelvis, and it makes somebody carry their head different, which would then make their jaw line up different, and they might hit different when they get to the dentist, requiring an equilibration or requiring an adjustment to maybe an appliance that they wear. And most of us don't even know that that's the thing, because how many of us are asking, how many times are you asking a patient that, how's your back pain ever since I did that dental work?
Close to zero.
Yeah, nor am I saying, or maybe I'm a little bit more apt to do this now, but in the earlier days when I was studying this stuff, I wouldn't say, oh, well, after we did this pelvic repositioning exercise and it looks like you're doing better down here at hips, has anything been thrown off up at your teeth? We don't think that way, but we are very much a one system stacked against gravity, and everything we do to change what happens down at the ground is going to change how we level our eyes and what position we put our head in. In the middle of all that happens to be this bottleneck where we breathe through.
What are some things people at home can do without us? Let's say I want to come to you for physical therapy or me for dentistry, but I want to also improve myself at home. Nate, what would you tell a patient saying, before you come and see me, do these things at home first to help yourself out?
I might just start with breathing.
Yeah.
Say, hey, as much as you can, try to breathe with your nose. If you're having difficulty sleeping, and ask some questions about that, because you can find a way in with that. And if you can even just improve someone's nose breathing, here's something that matters, that can influence a lot of different things. Here's a couple ideas. Maybe, hey, it's hard to breathe through my nose at night, so maybe something to open it up. That's probably where I would start. If I had one direction to go, you'd probably start with breathing and improving nose breathing.
I'm the same way. I always say, as much as you can, eliminate processed foods and breathe through your nose.
Yeah.
How about you, Craig? If someone's coming to you saying, hey, I live in California, I can't make it to Grand Rapids, what can I do right now today to make myself feel better?
Yeah, well, I mean, and there are options for people that are out of town or out of state, because we can do some telehealth options these days.
Okay.
Where we actually have a program that we call Breathe Well, where we can start talking about nasal hygiene, nasal dilation, breathing mechanics. Not everybody knows that belly breathing can actually cause some more harm than good because of how it's taught. I want to use the word belly breathing as diaphragmatic breathing. But often we learn that we're supposed to expand our bellies and not let our chest rise. So giving people opportunities to learn about the misconceptions of breathing and teaching them how to do it in a way that helps them improve their capacity for airflow. Those are all things that people can learn about. Buteyko breathing is a good concept. There's a lot of resources these days. It's a hot topic. So there are books out there. Patrick McCown with Oxygen Advantage and James Nestor, they talk about some of those ideas. And so giving people resources, like Nate said, to kind of get started in things that are pro-health, that you don't need to pick a side, you don't need to be in one direction, and we can be helpful and not harmful. Lots of strategies.
So is breath work essential to overall health?
Without a doubt. I mean, if you think about, it's the first thing you ever did.
Okay.
And it's the last thing you'll ever do. And we do it 20 to 25,000 times a day.
Okay. Then let's break this down for someone who is low intelligence like myself. I thought breathing was automatic. How am I supposed to breathe?
Well, therein lies the problem is that even, and this is my opinion, but I think it's been informed by lots of healthcare providers that I talk to. We don't actually learn how to teach proper breathing in medical education and healthcare education. In fact, in some cases, we learn to do it wrong. And the logic in that is that when we want to really support the most important muscle that we breathe with, that's our respiratory diaphragm. It's a big dome-shaped muscle in our center that when it comes down, it's pulling air into our lungs. And in order for it to be able to pull down, it needs our abdominal muscles to support the position of the ribs so that it can be efficient. Now, when we teach in healthcare, we learn in healthcare and then we teach in healthcare, belly breathing is to let go of the abs. Now, all of a sudden, we're letting go of the most supportive muscles to make sure that the diaphragm can do a great job. And if we learn it wrong, we're going to teach it wrong. And that in line is the problem. So finding an opportunity to correct that circumstance so that people can start to actually improve the way their diaphragm works. If you think about why people have sleep apnea and end up on CPAPs, often it's because the machine has to help them manage the pressure of breathing for the inhale, which means we're not
Mm.
really great inhalers. And what if our abdominal muscles were actually supposed to always help us manage that pressure? If we're letting them go in order to be able to take a big belly breath, could that be that balancing act that we need to try to decrease obstructive sleep apnea or other sleep related breathing disorders like upper airway resistance syndrome?
So tell me so I'm a 40-year-old mom. Like I'm thinking about my wife. She's not 40, by the way. Narina, I know you're not 40. Um,
Nice save.
nice save. She's a full-time attorney. We have 4 kids. She works a lot, takes care of the kids a lot, super busy. How do you tell this busy mom, put breath work into your life on top of everything else? What are they doing day to day to help their breathing?
So I like to start with teaching people to work on controlled breathing in terms of the pace of breathing, and then also making sure that we're working on a controlled pause. And so you could be driving in a car and work on longer exhales, shorter inhales. There are apps that you can use on your phone that help to time that for us.
Longer exhale,
Yes.
shorter inhale.
What we're trying to do is we're trying to blow out our air so that the diaphragm can become a tall dome. And when we get more air out, our ab muscles start to engage and we teach them that they have a breathing role in our life. So a long exhale, trying to get empty, then maybe pausing for a little bit. Could be 2 seconds, could be 5 seconds, depending on your health circumstances. You would determine how much you would want to pause. But we're trying to create carbon dioxide tolerance. It means that as we don't breathe, carbon dioxide is building up in our circulatory system, and our brain is measuring that chemically. And so, what it's going to do is it's going to create a shift and create a strategy for your breathing opportunity to change while you're doing the pause. Then, when you inhale, of course, inhaling through your nose, in your nose, we release nitric oxide, which helps us with the perfusion and the oxygenation of our blood. When we breathe in through our nose, we can fill the lungs, but not to the point where we're trying to fill in deeply. We're not trying to raise our shoulders up toward our ears. We actually want to expand our chest in a horizontal direction so that it improves the capacity to breathe, but it doesn't require us to use our jaw, our tongue, our neck, or our shoulders, or especially our low back to try to get more air in. And so that concept, no matter where you are in your health journey, you can adapt how many seconds you're exhaling, you can adapt how long you pause for. But if we focus on teaching people long, deep exhales, appreciating the sensation of abdominal wall contraction for a little pause, and then inhale peacefully through the nose so that we're not trying to strain to get more in. I would encourage starting with 5 to 15 minutes just to see how your body feels.
Okay.
Some people have other circumstances that diminish how much air they can get in. So if we're blowing all this air out and we don't offer space for air to come in, it can actually increase heart rate, increase the sense of stress, and it's a sign that your body needs to be checked. We need to look for the reason why. And so there are providers that can do that, something that we do in our office as well. But if your body feels better, then I would say lean in and continue and work yourself up to 20 to 30 minutes a day. Um, I think that if we can increase our carbon dioxide tolerance, and we improve our capacity for breathing, automatically, the brain starts to do that for us. So we become less over breathers. We're not taking breaths in so soon, and we get more perfusion or oxygenation every breath we take. So it becomes automatic and you don't have to think about it. It doesn't have to be something that you like choose as an exercise or
Mhm.
activity. We want to get to that point.
So, Nate, would you say that if we breathe less, going back to the part about safety in the brain,
Mhm.
that our brains will sense that we feel more safe?
Yeah. Yeah, and in general for sure. Especially if you're breathing less and you're aware of your body's reaction to it. Sometimes you start to breathe less and it feels suffocating. So once you kind of dial in what you want to feel, which is maybe I cue people up to do a longer exhale, a pause at the end of the exhale if possible, and then a gentle inhale through the nose that's maybe slightly less than what you would typically do to get just a little bit of air hunger, and then kind of monitor your nervous system's reaction to that. If you feel like, oh, this is I'm getting tense, then pause, just breathe normally, and then go back to it. So once they get it kind of dialed in to then it should make a big difference, and they should be able to notice it as well.
Is the exhale out of the nose or out of the mouth?
Just if at rest and you're just breathing in and out through the nose, but
Okay.
a lot of times when we're encouraging a deeper exhale, especially in some of the exercises we do, it'll be through the mouth, but it could be through the nose. But the mouth and pursing your lips gives a little bit more opportunity for the abs to be engaged,
Okay.
which is helpful.
Should I be taping my mouth shut at night?
So the same circumstances, we have to just proceed with caution that if somebody has the ability to breathe through their nose and we tape the mouth, then great things happen.
Hmm.
But there are some individuals that will have deviated septums and they'll have overbearing turbinates in their nasal passage. An ear, nose, and throat doctor or a dentist that does CBCT might look at that space and say, okay, there may be some other circumstances that we want to look at first before I encourage you to do this mouth taping. My experience is that when people try mouth taping that have restrictions that prohibit us from continuing to mouth tape, it becomes evident because they don't want the tape on.
Hmm.
Their brain is going to make sure that they peel it off, even if it ends up on the pillowcase in the middle of the night. People aren't necessarily going to succumb to asphyxiation because there's tape on their mouth, but we want it to have a positive result. So it should feel like good things are happening. Personally, for me, it took a little practice. I had to get several days in a row of mouth taping in. And now I do it every night and I won't not do it. In fact, when I miss, I can tell I am more congested waking up without the tape, as if to say that the tape promotes nasal airflow and it helps me get more of it than if I didn't tape. So I just think we read our patients and we read ourselves if we're trying it on our own at home, and it should feel like after several nights that good things are happening. I see increased sleep quality. I see lower resting heart rate. I see elevations in my heart rate variability as things that I'm tracking um, because I started mouth taping.
How do you track your sleep?
So I think the best way to track sleep is through your own body and your sense of rest. That's the best way to do it.
Like how you feel the next
How I
morning?
feel.
Okay.
But today we have so many wearables and measurable things. I happen to sleep with a watch that gives me some sleep metrics. I also happen to have a bed that has some sensors on it that allows it to, look at my respiratory rate, my heart rate, and my
Heart rate.
restlessness.
Your bed has sensors on it?
It does, and there's lots of products. I mean, it's a big industry these days. Sleep quality and breathing is so big that so many of the fitness trackers, like the Aura Rings, the Fitbits, the Apple Watches, they're not gold standard devices, which is why I like to deflect toward how did it feel for you? If your watch tells you that you slept better, do you agree with it? That's
Yeah.
kind of the question I ask my patients. You have to feel like it's helping. And I'll tell you, my sleep is so much more sound since I started taping. And I always tell my patients, I like to eat my own cooking. I won't necessarily give a whole lot of interventions that I haven't tried or benefited from myself,
Yeah.
just because I like to make sure that I can experience what I'm teaching. And so, yeah, nasal dilation and nasal hygiene and tongue myofunctional therapies, those types of circumstances are things that I consistently work with and monitor what my sleep metrics are doing when I try all of these strategies.
And do you find there's always a correlation between improved sleep metrics? I asked this question because I used to track a lot of my health and I found it was getting overwhelming.
Yeah.
I was tracking my blood pressure, I was tracking my waistline, I was tracking my sleep hours, my calories, and the bang for my buck wasn't there. I think for me, the biggest thing I track is if I can fit into my pants, something like a 32 waist.
Yeah.
And if they're getting tight, I gotta switch something up. Do you find that what you're tracking does correlate to positive results? Like you're more willing to try to improve what you're tracking?
Yeah, and so I'm going to default back to my original statement, which was it has to feel good.
Okay.
It has to feel like it's helping, and then you use a number to kind of record maybe the trend. Trends, I guess, a good way to think about that. And again, trending waistlines. There are lots of ways that may relate to your ability to manage your waistline that include diet, exercise, but also include sleep, sleep quality, and breathing.
Hmm.
Honestly, in terms of stress and cortisol and all of those things we know about how our body stores fat and reacts to stressful situations. Our nervous system, when it's trying to help us react to threat, oftentimes does it in a very reactionary way. It's kind of like the analogy I use is with seasonal allergies. Let's just say that it's ragweed. This speck of ragweed pollen that goes up my nose isn't going to harm me. But for some reason, during a ragweed allergy season, my brain and my body create this all out reaction against this speck of dust. It's an over the top reaction. And the same thing happens too when we have this sense of air scarcity, that if we don't think we're getting enough, the body's going to initially react by saying, take another breath. And it's going to take a shorter, more rapid breath. But in truth, your question earlier about could you could you breathe less and get more? Well, the truth is that if we breathe out more and then we breathe into where we're going to get more air in. And if that creates an opportunity for us to put more oxygen in the blood, the brain's going to measure that and say, oh, I breathed less and I got more. Well, the same thing is true with fat stores. The same thing is true with food and nourishment and hunger and what we need for our survival. That's all controlled through our nervous system.
I like when you said if your brain's not getting enough oxygen, it's always anxious. I always think sleep apnea is like a slow death. It's like I always tell my patients that untreated sleep apnea is probably the equivalent to untreated diabetes. It's not going to kill you immediately, but long term, it definitely does take a toll on your health. Nate, when you look at your patients that have untreated sleep apnea, we'll say,
Yeah.
what other maladies do you find that's happening in their body?
Oftentimes significant tension
Okay.
from and just movement restriction. I mean, you'll see not always, but you'll start to pick up on tension where muscles that are struggling to try to maintain a state of oxygen and carbon dioxide balance will just become tense. So neck tension and stiffness. So again, if I'm looking at someone through an orthopedic lens, I might be drawing that connection between that there's sleep difficulties and the muscles that are involved in trying to manage that breathing challenge. So any muscles that can help improve someone's ability to maintain the airway will likely be more active. So you'll pick up on those things for sure, Craig.
We call those accessory muscles of respiration. So if our primary muscle is our diaphragm, so think about sleep. During sleep, we should be at rest. Our body should be completely able to rest and recover. So all of the muscles that would normally move us should have a chance to check out. But our respiratory diaphragm is the primary muscle to drive oxygenation. So if the brain is only getting, say with the movement of the diaphragm, the brain is only getting 60% of the air it needs for sleep and recovery. The body has to find other muscles to get the other 40% because it can't survive without the 100. And those other muscles are all accessory muscles of breathing. So these are all the muscles that Nate is alluding to that would be sensing tension. So if we listed some of them, we have neck muscles that pull up on ribs. We have shoulder blade muscles that pull forward and upward on ribs. And we have low back muscles that can advance the lower rib forward by extending and compressing the low back. So thinking about people that wake up with more back tension than they went to bed with. They wake up and they have old man or old lady back, right?
Yeah.
What if those muscles were busy doing part of that 40% all night long? And then during the daytime, you've got to go and do a standing job or carry children around or be able to stand long periods of time and do things at the kitchen counter. All of those things add up because those muscles never get a break. The same thing is true with like clenching teeth. We use our jaw muscles to support our necks so that our necks can become really great pumps and lift up ribs to get air in like they're luggage. So literally trying to move rib cages into a position that they can expand better to make up for that lack of airflow that's coming from the respiratory diaphragm alone. And one last comment about that is that all of those additional, the accessory muscles, these are all muscles that need you to be a little bit of a little awake to be able to use them. So your brain's got to wake you up
While you're sleeping.
to use those muscles, because if you fall asleep and you go into the patterns of sleep where you're actually slightly catatonic, where these muscles are just completely dead to the world, if they are in that state, if you're in that level of sleep, those muscles won't help you breathe. So you have to wake yourself up to use them.
That is so interesting. I took a at-home sleep test, and I'm embarrassed to admit this. I have mild sleep apnea, but it also measured my sympathetic, parasympathetic, and I am in sympathetic 75% of the night. 25% I'm relaxed, and I sleep 7 hours. That totally makes sense because I'm sure all my accessory muscles are just running nuts at night, and I wake up and I feel like garbage
Yeah.
because my AHI is 5.1. But that totally makes sense. My body has to somewhat wake me up to keep me alive, to get oxygen. So I'm using my body in a way it wasn't designed to be used.
So let's look at the other side of that coin. Instead of saying, "Oh, woe is me, what do I need to do?"
Well, that's all I want to say. Woe
do
is
I
me.
need to, yeah, do I need to subject myself to a CPAP? Well, maybe if that's what you need to get air. But what if at the same time we were looking at other strategies to improve that hypothetical 60% diaphragm and make it 70 or 80 or 90? What if the start of that was long exhales with pauses? Now you're asking your diaphragm to ascend or go up and get used to being up there. And then when it pulls back down, it's going to pull more air in. Your brain's going to become more efficient. And if that muscle is the one that needs to do that while you're sleeping, daytime improvements in that muscle's performance can lead to nighttime benefits.
I'm definitely going to do more. Because I do zero breath work. I talk about it at work all the time.
Yeah.
I'm sitting on my high horse, but I have to do it.
Yeah.
Because you're totally right. If I can increase my diaphragm and almost like exercise your biceps, I can turn my sympathetic system off while I'm sleeping, or somewhat off.
Yeah. Well, the age-old question when you meet somebody, especially in older generations, they say, "Well, what do you do for a living?" "I breathe."
Yeah.
Literally.
Yeah. That is the best dad joke. So it seems like kind of all this comes back to how do we help people breathe better? Because breathing is essential for your body to feel safe. And then there's been breath work for 5,000, who knows how long they've been doing it. So we have to somehow help our patients breathe better outside of our normal licensed therapies.
Absolutely. And there are ways to do that. The tricky part is that you just want to make sure that the strategy that you choose is creating functional change in your body. Because if it's not, it's probably not the right strategy. And unfortunately, there's a lot of misinformation in our healthcare education. I think I've alluded to that.
Yeah.
And I'm trying to dispel that. That's one of my main passions and missions in my career as a healthcare provider, is that we can't keep doing things that make us less healthy and then choose a device or a medicine or a procedure to try to make up for lost time. We want to get back to how is the body physiologically supposed to do this and work toward that direction so we can optimize our healthcare.
It seems like if we put our priority on sleep and breathing, which I try to do a lot in my practice, that's a huge lever for health. Are there other levers we're not hitting on that you guys see in your patients that, let's say their sleep is optimized, their breathing's optimized, what's next? What other lever can they pull to feel better?
I like to inform people that are in their developmental processes. So for the moms out there that have children, one of the reasons why we study what we study is because we're adults that ended up with circumstances that needed to be remediated because developmentally things didn't go as well as we had hoped, and we did the best we can with what we could. But if we know more now than we did then and we make better choices now, we can actually be advocates for our children as they grow and they develop and make sure that we're getting really good oral hygiene, very good tongue function. We want a mature swallow because that's the gateway to air entering the body. So if we're talking about how important breath work is, the tube that we breathe through needs to be fantastic. And that whole tube is developing from birth through our developmental years of life as we're expanding and as we're growing and as we're changing. So I think looking toward our children and informing moms and dentists and pediatricians what we should be looking for and reacting conservatively but appropriately early on is a great strategy. But for those of us that are beyond that in age, knowing that there are symptoms that we might have in a medical setting, things like constipation, things like food sensitivities, and reactive guts and inflammatory gut syndromes, we don't always make these connections between the disciplines. So you might see a gastroenterologist for a gut problem, and you might see, a dentist for your tongue and your palate, and an internist for other health conditions, but they're not all talking to each other. But when we develop a low-lying tongue with an insufficient swallow, that swallow is what starts the digestive process. It's called peristalsis. And with slow peristalsis, we have a condition often that comes with it, which is gut dysbiosis. And gut dysbiosis might show itself up in care plans with physicians or with functional medicine specialists as like leaky gut syndrome or gut barrier panel issues. And so all of these things interrelate and are informed by our swallow, informed by our breath. The ability for the diaphragm to rise and fall helps us with the pumping of our digestive system. Gut inflammation can cause distension in our abdominal wall and make it so it's hard for our abdominal muscles to support our ribs to make sure that our diaphragm can be a great pump. All of these things interrelate. So making sure that your healthcare providers are talking to each other and making sure that we're asking good questions about how one thing relates to the other, I think is a really great direction to help lead our patients.
What is a mature swallow?
Yeah, so we should be able to, at rest, when we're not using our mouth, we should be able to have our tongue resting on the roof of our mouth, close to our front teeth. There's a little bump right behind our front teeth called the incisal papilla. So the tip of your tongue touches that at all times that you're not using your tongue. The rest of your tongue rises up to the hard palate and rests in light contact, even more importantly, really light suction, like a suction cup, all the way back as far as it can, and have you still be able to breathe freely and easily through your nose. Most of us, when we try that, we realize that our tongue's been down the whole time. The tongue hardly ever touches the roof of the mouth. But if I told you that the tongue is always supposed to rest in light contact at the roof of the mouth to lend support to the head and support to the cranial bones at all times when you're not using it, that position is a starting point. From there, we should be able to draw any food or liquid into the tongue and create a wave-like motion to push it back into the throat. So then the muscles of the throat can then squish it down into the pipe. So to be able to get all of that through as we swallow without feeling like we have to move our head forward or we have to make different facial expressions or that we chew really fast and swallow right away. Like we should be able to chew our food to mush and control that swallow. There's lots of therapies for that. But most of us as adults, we try and we realize nobody ever taught me that my tongue was supposed to be on the roof of my mouth. I hear that all the time.
Mm-hmm.
And that when people try to do it, they realize that it takes a lot of effort. And these are things that we're not supposed to be thinking about. We're not supposed to be putting effort into it. It should be happening automatically.
Well, it's wild because the way we were designed and the way our body functions now are like totally different. So now you have to actually consciously think about how do we move our body? How do we swallow? How do we breathe? When 1,000 years ago, we're just trying to stay alive and invent fire.
And a lot of
Yeah.
people attribute that to the softness and the processing of the foods that we have today.
Oh
The
yeah.
muscles that we move with need to be strong. And in order to strengthen the muscles of the jaw and the tongue, we need to work with them. We need to build strength in them. And so softer foods diminish our ability to have strength in that area. And the development of our cranium happens because of muscles that pull on the cranium. And most of those muscles are influenced by the tongue, the teeth, the jaw, and the neck.
You just hit a great point. We don't chew hard foods like we used to. And me and Craig actually just started a clear aligner therapy where we chew on this thing for 30 minutes a day.
The Freedom Appliance.
Yeah. Awesome. So we're getting close to the end. I want our viewers to know where they can find your clinic and how they can get a hold of you if they want care from your clinic.
Yeah, Nate and I work out of our home office in Zeeland, Michigan. It's simiohealth.com. And we also, because of the specialties that we hold, we serve patients across the state of Michigan in satellite offices in Flint, in Ann Arbor, in Jackson, and in Lansing. Different days of the week, different weeks of the month. We work with osteopaths. We work with dentists. But what we do is we try to add our influence on the entire system so that we can support the whole gain, including dentists and even all the way into podiatry. So our office is in Zeeland, but we travel to make sure that we're supporting the interdisciplinary providers that are looking to integrate in these postural therapies.
Okay. And then Nate, I'm assuming you work at the same clinic.
Correct.
They can find you the same way.
You got it.
Okay. Well, this has been another episode of the Dr. Vincent Buscemi podcast. I really appreciate you guys. Thank you so much for coming out. This is a blast.
It's a blessing. Thank
So
you.
Yeah.
we'll be working with dentists that are so like-minded and interested in expanding the outreach for airway, airflow, and postural therapies.
Thank you.
Absolutely.
Thank you. And I'm Dr. Vincent Buscemi. I'm in Bloomfield Hills, Michigan, and we'll see you guys next time. Thank you.